Well, good afternoon, good day, good morning, good evening, wherever in the world that this message finds you. I'm so excited to welcome you to our February 2025 webinar. I'm here with Deborah. She is the president and believe chairwoman, actually, of Heart, basically co-founding principal agent to HeartMath Institute. She has been with the HeartMath mission for since its inception, honestly, and we are so excited that you're here with us today because we're diving into heart health this month, this February. And we really wanted to not only talk about the biochemistry and the foundations in terms of nutrition to support cardiovascular health, but there's the coherence of really the heart, body, mind axis that heart math has been so influential and so, I guess, so just appropriate to bring into this conversation because they have revolutionized the science behind that coherence. And we're excited to be partnering with them and really extending their offering to you all as health professionals with Premier Research Labs. So we'll be diving into what heart coherence means, the science behind the HeartMath Institute, and just having a really good conversation of the importance of kind of, what is this engine that fuels the emotional and the physiological and the bioenergetic body that we all know and love. So, Deborah, if you don't mind introducing yourself and just welcoming the audience and kind of talking about heart math a little bit before we go into some questions.
Well, thank you. Well, yes, Deborah Rozman. I'm the president and CEO of HeartMath Incorporated. And what is HeartMath? Well, think of the math of the heart. Like, how does the heart communicate with the brain, the nervous system, which is part of the brain, the body? And what is the role of the heart in perception, in emotion, in performance, in well being? The heart is much more than just a physical pump. And so
Mm.
when we started the HeartMath Research Lab at HeartMath Institute back in 1991, we were long-term meditators that knew that that connection with something bigger than ourselves or with each other had to do with
Mm.
the heart feelings. And how did that connect with the physical heart? So we set about researching with wonderful advisors in the whole cardiovascular, neurological, academic fields to see if we could map out this heart brain body communication system. And that's why we call it heart math. And we did. It was published in the American Journal of Cardiology in 1995. And then that spawned a whole lot of training programs, techniques, tools, technology to get our heart and brain and body in sync for optimal health and higher performance.
And we're going to be featuring a lot of the offering that HeartMath has, and we have some wonderful links that we'll be sharing with you all as Premier Research Labs health professionals. But I would love to maybe for the audience here and maybe to talk about your journey to HeartMath. Was there an aha moment where you were like, we really need to be looking at the coherence of the main organ gland system of the cardiovascular system and how that translates into the mental like health and emotional health paradigms of the individual? Was there something that really spurred you? We need to go down this path to better understand really emotional and heart coherence in
Yes,
total.
there was. I'm a behavioral psychologist by background, and I was teaching and helping people with the Gestalt psychology in behavioral health. And one day it dawned on me after years of working with people and finding cognitive behavioral therapy had limitations, it didn't always change the feeling world. I had people practice sitting on a pillow and being their heart talking to their head on another pillow, and then switching roles
Mm,
and being their head talking to their heart and going back and forth about the problem. And then what always happened is they settled in the heart and a different energy, a different wisdom came out of them and an aha moment. And I went, whoa, this listen to your heart, follow your heart, go to your heart for an answer. These aren't metaphors, there's something real there. And so I really wanted to investigate that further. And then I met Doc Childrey, who's the founder of HeartMath, talking about the intelligence of the heart. And I just pinged, I said, whoa, that's true. There is an intelligence that we access when we connect with our heart. And he wanted to start a research lab to study it. And in that research process, we looked at EEGs, we looked at galvanic skin response, we looked at EKG to see if there was any way we could intentionally interact with that. This was way in the early 90s. Dr. Joe Camilla, who labeled alpha, beta, theta brainwaves, was in our advisory board. They're all looking at this problem of the heart. What's its role in all this? And what happened was that we discovered by looking at the beat to beat changes in heart rate, called heart rate variability, used in fetal monitors, we could see emotional state change. That began the whole investigation in how the autonomic nervous system interacts with our emotional state. And really seeing how when we can get more synchronization in the nervous system, we create in the HRV pattern a harmonious sine wave, and we call that a coherent waveform in physics.
Mm-hmm.
So heart coherence, we found through the vagal nerve and other pathways, sends a different signal to the brain all the way to the amygdala and the frontal lobes when our heart rhythms are in this coherent waveform. And that's when we have access to our heart's intuitive guidance or the wisdom. That's when we feel connected. And it was just amazing to be able to see that over and over and over in the research. And when people feel stressed, anger, frustration, anxiety, there's a dysregulated nervous system. The ANS is really fighting each other. You see a very jagged, irregular pattern. And the more upset you are, the more stressed you are, the more jagged it is. And we thought maybe we can create some techniques and technology for people like a heart biofeedback to facilitate them shifting out of that chaotic, dysregulated nervous system into that coherent heart rhythm pattern. And we did. We created heart focused breathing combined with what technique we call quick coherence, technique we call freeze frame to connect with that heart's guidance. And we did a lot of pre and post assessments and measures, work with military intelligence, work with companies, work with hospital systems. Again, it was a research institute.
Mm-hmm.
And when we found what really worked at the highest ratio, that's when we began productizing it and providing it for the world. And now we have a new HeartMath app. We have a new sensor that we're partnering with Precision Premier Research Lab on to get this to people, because stress is so prevalent these days, and it seems to be getting worse every week with the uncertainty and unpredictability. People need tools, and they can really see what's going on in their heart, in their physiology, when they're feeling stressed, or as they practice the HeartMath techniques to switch into this heart rhythm HRV coherent pattern. And it changes how they perceive. It lifts their vibration, lifts their emotional state. It's really the operating system. And being able to tap into that is so rewarding. And that gives me a lot of passion as a behavioral psychologist to provide this to people.
Yeah, it's truly the greatest wealth when you find that level of coherence in your body and your mind and your emotional state. Can you talk to us a little bit, as we have a lot of physicians listening on today's call, and they may be acutely aware of a client coming in and they're not in that coherent wave state, but is there with the techniques and the coursework and the technology, I believe that this is probably something that everybody could benefit from. But, when a physician's looking to maybe implement this program with a certain client, what are kind of some presentations and who seems to be most approachable to a discussion around this, or how can you kind of open that door as a physician to allow people to really take hold and try, the
Right.
techniques and the modalities out?
Well, that's a great question. We find we actually have a HeartMath clinical certification program for physicians. We have over 10,000 physicians, mostly mental health, who've been certified, but they can be cardiologists, anyone, because as you get your heart, brain, nervous system re-regulated, there's a host of improvements in immune response, hormonal response, all sorts of healing modalities. And again, we have this sensor that people can use, clip it on their ear, goes with an app called the Inner Balance app or the HeartMath app. There's 2 apps, and begin to actually see in real time what their heart rhythm HRV pattern, not amount of HRV, as much as you see emotional state and the pattern of HRV, and how they can, within a minute or two, shift that pattern and feel the emotional shift and feel within a few minutes how the heart brain synchronize and give them more of a balanced view of what's been stressing them. It's powerful access. And so we always suggest that the health professionals start with themselves, because
Mm.
everybody's got extra stress these days, and there's so much stress in the physician and health professional community. We work with the whole Kaiser Northern California system. We have over 150 chief nurses who are certified in HeartMath methods and being able to use it for their own stress and burnout, but also teach it to patients. So the health professionals can take our HeartMath clinical certification program. It's online. They can get the sensor and they can begin to use the HeartMath app, which you can download at lifetime access when you get a sensor,
Mm.
and be able to be handheld through the onboarding of the process of creating and increasing coherence, baseline coherence in your heart rhythm pattern.
I love
And gosh, thousands of success stories they can see on our website.
so beautiful. Would you be willing, I know it's the middle of kind of the workday for a lot of people, and they may be coming in listening to this live, and or they may be listening to this later this evening or a week from now, and they may find themselves in a discoherent state. And would you be willing to maybe share one simple method that y'all have, really tried and true method that y'all preach and teach as part of the programming?
Absolutely. I use this several times during the day, either to prevent a stress reaction if I know I'm about to go into a challenging Zoom meeting or phone call with somebody, and or to recover from a stressful episode. And a lot of docs use this technique in between seeing patients. It only
Mm.
takes a minute or two, but you're resetting your nervous system, you're regulating. And so much stress that's not resolved these days is due to dysregulated nervous system that just builds up over time and becomes insatiated, is no matter what we do.
Mhm.
And that is part of the secret sauce here of why this works so quickly and effectively. So I'll share it with you now, and you can try it yourself throughout the day. And again, if you have a sensor, you can actually see what's happening in
Mm.
real time in your HRV rhythm as you do this. So let's do this together. You can close your eyes if you want, do it open eyes. You can put your hand on your heart to keep your focus there if you'd like. The first step is heart focused breathing. You're focusing your attention in the area of the heart. And pretend your breath is flowing in and out of the heart or chest area. Breathing a little slower, a little deeper than normal. Just find an easy rhythm that's comfortable. Maybe to count, if you're going to count, till about 6 seconds in, 6 seconds out. A 10-second rhythm is usually what brings the nervous system into coherence, but it varies a little bit for people. But find an easy rhythm that's comfortable.
And if they find that the body's fighting that at all, do you tell them to kind of lean into that? Talk like about the natural rhythm of the breath. What is there
You
any?
want to find the easeful rhythm that feels right to you. And so it starts off with that, but that's only step one. So let's do that together for a few more breaths. And now, as you continue heart focused breathing, I want you to activate a feeling of calm or appreciation or care, something that you really appreciate or have valued in your life. You want the heart feeling activated of calm or appreciation, or someone or something you care for. It could be a family member, a pet, something that evokes that genuine heart quality, gratitude. So you couple that with the heart focused breathing. And that synchronizes the autonomic nervous system, the parasympathetic and sympathetic, and sends that synchronizing signal to the brain. I look outside where I'm at a redwood tree, and that always puts me right in my heart and in that coherent state of appreciation.
And then you just take that and sit with it for the rest of the day,
And you
right?
take it into your next activity. So now you've recentered, you rebooted your nervous system, your heart, brain, body. And that creates a cascade of 1,400 biochemicals
Mm,
changes. Just like when you have a stress reaction, a fear or anger or anxiety, there's a different set of biochemical reactions that happen that course through your body. And it can take your body hours to regain balance. When you cut through with quick coherence, this technique, it releases another different set of biochemistry saying everything is in balance and moves your immune and hormonal systems back to balance as measured by salivary IgA. So you're very quickly resetting your system. That's why so many docs use this in between seeing patients.
hmm
And it gives you much less burnout or energy drain. You create flow. And isn't that what we all want? And isn't that gives higher quality care to our patients? And we have more access to our own intuition, which is wonderful when you're seeing a patient.
It's truly beautiful. And that, as of, I believe, it's especially in our field, we're in the business of healing, and that intuitive nature of the human experience and those emotions provide the greatest value to a client's or their own, as a health professional, their own individual journey towards health. And it's just
Absolutely.
a beautiful paradigm. Can you talk to us a little bit about, the research that you've seen around these, when you embody that intention around emotional states? We've talked about the coherence, but have y'all looked into how like gratitude based meditations versus maybe, insight meditations where you're just really looking at what's coming up in the body, how that's changing the biochemistry? Is there a difference that's kind of seen between those types of intentions with meditation that y'all have seen in the research you've done?
Yes, we have. It's interesting. Mindfulness or insight meditation, you're becoming more aware to observe without judging or getting hooked into whatever the thoughts or feelings or sensations are. And that's very powerful. Emotional awareness is very critical to even know what you want to shift or what doesn't feel right. That's step one. But the loving kindness, the activating the heart feeling is what brings the system into coherence. That's why we combine heart focused breathing that enables you to become more conscious and aware and accepting of whatever is going on. And then activating a heart quality, a feeling of love or kindness or care or appreciation. Any of those uplifting heart qualities lift the mental and emotional system into a higher vibration through creating coherence in the heart rhythm pattern. That's what's so unique. You have a window into your attitudes, your emotions, your soul as you look at this heart rate variability, heart rhythm pattern over time. And so, even just 5 minutes of practicing quick coherence with the heart rhythm feedback, so you can refine it instead of in your head, it's got to be in your body that you're doing this and creates an amazing shift. As people call it the wow factor.
Mm,
They
hmm
can really do this, they can see the change. And that's very empowering for everyone.
That's so beautiful. Would you be willing to share insights into your own journey, because you're leading the way with how the heart math's evolving and what y'all are looking at and the research you're doing. Talk to me a little bit about where Deborah was when you first started the Heart
Yeah.
Math Institute and where you are today in your own journey.
Well, it's interesting. I was a dedicated meditator before 1991 when the HeartMath Institute started. But I would find I'd meditate in the morning. I'd go to work and I worked for a company called Biogenics, and it was a high pressure environment, lots going on. And I would get stressed out, but I didn't have any really tools. I would do breathing, yes. And we always tell each other, just breathe. But I could still get drained. I'd get an argument, my vanity would react, my ego would get there, and I'd be drained during the day until I couldn't wait at 5 o'clock, get off work and do another meditation. And that became, it wasn't just me, a lot of people experience that, or go for a walk or go to the gym. But the drain during the day would keep my perception at a certain level. Now, when we started HeartMath and we saw this research and we started using tools like quick coherence or heart focused breathing or other heart lock-in, that's another technique we teach where you're actually radiating through the heart's electromagnetic field a heart quality of gratitude or appreciation. And that amplifies the heart coherence, that intentional radiation of love or care or appreciation, or sending it to a loved one or sending it to the planet, actually amplifies heart coherence, makes it easier to stay in it longer. And the research was so convincing to me that I would start building in times in the middle of the day or before or after I got stressed to really quickly reboot and stop the energy train. So we created a thing in our training programs called the depletion to renewal grid. So we map out as we train people, where do you spend most of your time during the day, becoming more aware, emotionally aware of when you're in high heart rate, positive feelings, or high heart rate, anger, frustration, or how much time you're spending in low heart rate, negative feelings like sadness or boredom or depression, or low heart rate positive feelings, renewing feelings like peace or quiet joy or kindness. And as we map that out in that grid, we learn how to shift through heart coherence practice from one side of the grid to having more ratio of time in the uplifting side. So that emotional awareness, and then using the technique and the technology, the biofeedback, to refine your practice. People within 6 weeks who said often to always they were anxious or couldn't sleep or had physical symptoms of headaches, and it all correlates, or other body aches, and then relational problems, the stress effects. We're able to shift them. So there were 40% reduction in anxiety, 60% reduction in depression, 30% improvement in sleep, more stats like that, which you can see at the heartmath.com homepage. We cover all that, 15,000 pre and posts. It's amazing that in 6 weeks, people have a new neural habit and they have the tools to keep reinforcing it. That's powerful medicine. And that's the power of your own heart.
And I think it's so beautiful because it's a medicine that's accessible to us all just with awareness, right?
Yes.
And what y'all are doing at HeartMath is really crafting a templated program to bridge and build into and lean into the depth around that awareness that really manifests itself in terms of those almost that healing property of when the mind and the body and the heart are in coherence. I have a working theory of, and we're very big here at Premier, if somebody's new, maybe listening in, we very much so align with the bioenergetic body and, how each organ gland system emits a field and how the substances and the people all around us are emitting those same fields. Talk to me a little bit about, somebody that's very deeply entrenched in, functional recommendations of nutrition and the biochemistry. How would you kind of translate the reason why they should really implement these practices and these techniques with their patients when they're so maybe a little bit more blood and guts, right? And that's okay. We love that approach. It's very allopathic. It's westernized medicine. And there is facets to we're waking up to HRV and how the mind and the body and the axis all play into it. But what's the Deborah perspective on why this is so important in that regard?
Yeah, well, you know, there's a lot of wrist devices that measure HRV, but they're measuring the amount of it, and it has to relate to recovery and sleep. That's important, but looking at the pattern, which is the horizontal axis of what the HRV pattern looks like over time, and the wrist drops the interbeat intervals. It's not a great place to measure it. So that's why we have the ear clip, which is a wonderful place to get all that data, that
Mm,
information. That can guide us individually as we do that ourselves with the HeartMath app, the instructions to how to improve sleep, how to stop emotional eating, because so much stress eating has to do with comforting, self-soothing, self-comfort. Whereas this is self-comforting as you activate the heart feelings and heart energies. That's the most wonderful, uplifting feeling of joy and love and kindness. You open the heart again, even if you feel your heart's been shut off because of trauma or hurt. This helps you start to open it up again and self soothe. And that's so important because nutrition's important, exercise is important, but without addressing the stress reactions, or we have a whole program on the resilient heart, a trauma informed
mm,
training program for health professionals of how this can help release PTSD and trauma imprints because you're sending a different signal from the heart to the brain. There's self compassion, a whole nother level of qualities that put you into coherence.
mm.
Now, some people may say, well, self love and self compassion is self centered and narcissistic. We get around that by saying, look what it's doing in your HRV pattern. You don't, activating love or gratitude, or when we teach children, your love of chocolate chip cookies, that's way fine. It creates that coherence. Now, when you're in that state, let's apply that feeling, that perception you now have, that balance to other issues in your life. That's where the heart intuition is activated, because now you're in sync, and now you go from emotional eating to intuitive eating, listening to your body and what it really needs. So it's a powerful, essential tool to be able to make better and more effective choices.
So beautiful. It really what comes down to it's all about listening, right? And this programming and what I know a lot of health professionals are teaching and helping their clients understand is how to better listen to their body. And this is kind of the next pillar, right? And helping to
Right.
better nourish. And so I love that. Talk to if somebody's gun ho, they really want to get involved and they're ready to take the leap into achieving coherence in themselves and with their patients. I know we will be sending out links following the conclusion of this presentation, but um, you know, what are kind of the best steps, and kind of getting involved with HeartMath and do they go straight for the certification? Is it
Yeah.
best to, just go into the app and try it themselves? How would you recommend a health professional evaluate getting
Two
involved?
things. That's a great question. Take the HeartMath clinical certification. It's not expensive. It's on the website. It's self-learning, but it'll give you enough of the science as well as the instructions of what you can do for yourself and your patients for emotional regulation. We also have the HeartMath Interventions program, which provides you with the professional version of the HRV biofeedback that we have called the M-Wave Pro. And if you see clients in your office, you can track, they can come in and you can track their progress over time, as many patients as you want. So those are options. The other option is for yourself, is to download the HeartMath app. It's free. There's a 7-day free trial. Do the onboarding, get the sensor for yourself because that gives you lifetime access. Otherwise, you would subscribe for a year at a time and learn what that feels like, because that's what you're going to recommend to your patients. And you can become an affiliate if that's interesting to you. So you recommend to your patients and you profit from that as well as they profit tremendously by doing it. Or, you can join our HeartMath health professional group once you do that and get all sorts of support materials in our learning center, our research, I mean, on and on. So I would suggest people start with themselves
Mm.
and start with the HeartMath certification. You'll be sending out a link, or just get the sensor, start with this right away and get the app, and address your own stress issues. And that'll give you the direct experience. Every one of your patients should have the HeartMath app. That'll enhance whatever other modality and interventions you want them to do, whether it's nutrition or exercise or anything. I mean, we do a lot of work with the functional medicine group, and they have HeartMath training as part of their program. But like I said, there's like 40,000 health professionals who've been involved with HeartMath, and we're just getting ready to do some promotion and marketing and ramp all that up.
Yeah, it's exciting because when we first connected, it was just kind of like, oh, this was meant to be because y'all are so aligned with our values in terms of, we've always preached a concept known as emotional repolarization, which falls
Mm.
just right in line with, the Heart's Math strategies. And so I'm excited for the collaborations hopefully to come in that regard. And, um, you know, I would love to, as we kind of wrap up this segment, talk about the vision. What do you see HeartMath doing, and how do you see you all being positioned as we kind of go through this next decade, given that I believe stress is only going to continue. Suffering is part of the
Mhm.
paradigm, being human and being alive, and we really want to encourage people to better love themselves as they approach to love others, especially in a day and age where technology and just everything is moving faster and everything feels less heart focused, right? So,
Yes, that's
um,
right.
talk to us a little bit about, where you'd like to see you all be as we
Right.
go through this next decade.
Well, our mission at HeartMath is to help awaken and activate the heart of humanity. And the mind, without being in alignment with our heart, has gotten us into this stress bath that we're all in. And you will see the increasing fear and polarization and separation and hate. And that only has a trajectory of destruction and self-destruction. And we all know that. But how do we overcome that? 1990s was called the decade of the brain, but in many ways, it was the decade of the heart as well. It was when the heart was discovered, not by us, but other universities, to be a hormonal gland with receptors in the brain for balancing hormones. The heart was discovered to have an electromagnetic field that you could measure 3, 5 feet from the body, but we know it goes farther than that because we affect each other with our vibes, and all that is being broadcast. Our feelings, our attitudes are being broadcast with every beat of our heart through our cells and outward through the heart's electromagnetic field, like cell phone waves or radio waves. We've discovered things that are just amazing about how the heart actually communicates to the brain in 4 different ways. Hormonally, blood pressure is one, which is about all that most people know, but through the vagal nerve, through the nervous system. So taking these technological advances and turning them into techniques and tools that we can use to regulate our emotions and nervous system and manage the stress as it's increasing, to me, becomes so important in looking at the heart as a center of intelligence. We wrote a book called Heart Intelligence, connecting with the heart's intuitive guidance for effective choices and solutions, and the research behind that, and the tools of how to do that so you're more aligned and able to listen to your deeper heart. I mean, there's so much about the heart that's just been discovered. And
Mhm.
so we know that love is what makes the world go round, but most people don't know how to access love on demand or in a way where it's pure and just getting that heart coherent alignment in your system. So that's where I see us going. We created the HeartMath app, just released it. Um, it has a camera sensor in it, so you can start to measure HRV through the light of the camera, which takes the blood flow and algorithms convert that into heart rate and heart rate variability, and then how much coherence is in your heart rhythm. That gives billions of people the opportunity to see in coherence feedback, because
Mm-hmm.
people have smartphones throughout the planet. And if you want to go to another level of really practicing coherence, then you get the sensor. But there's all sorts of 30 years of content and our research in that app. And our vision is 100 million downloads, because we need to raise the love vibration, the heart vibration on the planet, where
Mm-hmm.
more people are practicing compassion, loving kindness, because it's intelligent. It activates the higher frontal lobes of the brain. It's not just a nice, sweet thing to do. So we only want to see that happen and help love go viral. That's our goal. And the health professionals are key to that, because they're the ones who are telling their patients, do this to improve your health and well-being, mental, emotional, and physical.
So true. All the health professionals listening, you are all are true stewards of, our really global population waking up to what is truly health and what truly is the human spirit. And Deborah, you were a steward and a missionary in that light as well. And I can speak to my own journey in terms of, when I'm coming from a true making decisions from my heart, right? And feeling that peace that kind of
Yeah.
reverberates out when it's a true heart aligned action. Every decision and moment and action that cascades from that one moment is much more aligned. And it's almost like if you're looking to alleviate stress and long-term stress, we all should be in kind of having that mantra of making decisions that are best for our heart, but sometimes we don't realize what is and what isn't, and when our heart's actually speaking up that, hey, whoa, we shouldn't be doing this, right? The
Right.
mind likes to override that so often. It-
Absolutely. Well, you
yeah.
know what I find, my heart now is loud and clear most of the time. And if I'm really attached to something, I go take my sensor and I say, when I'm in coherence, what's the best heart intuition readout can I get? And then you step into that and do it. And it creates flow, or it creates stronger feedback. Oops, that wasn't the right way to go.
Mm,
Okay, let me pause and reset. But it's like a stop and go, light. Red means
mhm,
and you feel it in your heart like a resistance. Yellow is pause, consider, and green is ping. This is it. Let's step into it. And you train yourself into your heart signals,
mhm,
because they're real. They're real feedback. That's your real biofeedback. But sometimes we need a sensor to actually train us in that, give us training wheels to be able to hear and listen and refine ourselves with our own heart's biofeedback inside. And so, yes, it's the operating system. It's like, wow, this is how it works. Let's get this to everybody, and start with yourself. Start with testing it. Be your own self scientist.
that's so true. I mean, it really is the journey to self. And, we grow up, we go to college, we get all this knowledge, we get all this cultural influence, society influences us. And, I believe this program and, what it's really about is loving thyself and knowing how to love thyself and making decisions that are heart aligned and heart affirmed. And,
Right.
I just in speaking that, I feel like just weight shedding off, my
Mhm.
body, right? And so I think that's important because sometimes we like to pile on all these different things when really
Right.
when the heart inside knows what's best. So um,
Absolutely.
thank you so much, Deborah, and thank you so much to everybody at the HeartMath Institute for what you all are doing and your mission and just the stewardship that you're bringing. And um, anything you wanted to kind of close on today's segment for those that are
Yeah.
listening in?
I just hope people hear the truth of what you just said and what your own heart would know. This is the next level of human unfoldment, I believe. The next level of human evolution is consciousness, is bring the heart in. The mind by itself has gotten us to where we are right now, which is a
Mm,
lot of separation. The heart brings us together, and we have to do this together. It's all about collaboration, co-creation, care, kindness. And I just want to encourage anybody listening to this, listen to your heart. Download the HeartMath app. It's free to get started. go to the information that Will's going to be sending you. Check out heartmath.com and the health professionals. We're here to serve you. And please be kind to yourself. Have compassion for yourself because you're important right now. Your role is very important in the emotional mental health crisis going on, which leads to physical crisis. So how I can serve you is my pleasure. And you just tell us how we can help more. So thank you.
That's true servitude, and we're here to help all of you all listening in. So, in closing today, I just say everybody take a deep breath, know you are loved, and know that we can't wait to be sharing all the insights and the wisdom and the future collaborations with the HeartMath, and be on the lookout for some helpful links to get you started with everything they have to offer. So, Deborah, thank you so much for your time and your wisdom, and I'll look forward to talking to you again very soon.
Yeah, thank you, Will, for being such a leader in this area. Thank you so much. And I look forward to next steps.
Sounds wonderful. Everybody listening in, have a beautiful evening, beautiful afternoon. We'll look forward to catching you back here with our next webinar series, which we'll be doing in just next week. So I'll look forward to seeing you soon and have a fabulous day. Stay radiant.